Only 4% of women give birth on their due date. Here's why counting down to your due date is a bad idea. Due dates are only an estimate of when your baby's going to arrive. It's not an etched-in-stone appointment. First-time moms, if left alone to go into labor naturally, tend to be pregnant for about 41 weeks and 1 day. Women who've had babies before tend to deliver around 40 weeks and 3 days. Only about 10% of women go longer than 42 weeks. That's average. Some deliver earlier and some go a little longer, and it's almost always completely normal. A little frustrating, maybe, but still normal. Your due date is set at 40 weeks, and many care providers emphasize that anything after 38 weeks is considered full term. And that's where the problem lies. It just sets women up for disappointment. 2 weeks before her due date, she starts thinking, any day now. When her due date crawls past and nothing happens, it's disheartening. If she still has a week or so to go, it feels like torture. It also sets her up to think she or her doctor needs to intervene to get things going. This is why many pregnant women chose to induce labor with medications. Most of the time when women go past their due date, nothing's wrong with them or their babies. They're just not done yet. Unless there is some indication that there's a problem, just chill. It's going to happen. We believe the doctors should prefer the idea of a floating due date. It would be kinder and more accurate to tell women, your baby will be here sometime near the end of August or beginning of September. Then, women won't think there is anything wrong with them. Due dates set the stage for the unpredictable nature of parenting. There are so many things you don't really have any control over. Just sit back and wait for things to happen in their own good time. It's not about the schedule. It's not about the destination. It's about the journey. What factors affect your due date? While there aren't any hard and fast rules as to why some people deliver before their due dates or why others deliver later, there are a few things these groups have in common. Multiples. You're more likely to be part of the crowd that delivers before your due date if you're carrying twins, triplets, or more. Age. Your age can impact the duration of your pregnancy. Those who are 35 and older, for example, are more likely to deliver prematurely. Weight. Both the weight of the expectant parent and the unborn child can affect your delivery date. So, stop worrying about your due date. Enjoy the magic of pregnancy, or, at the very least, enjoy uninterrupted naps. Whether your baby comes before, on, or after your due date, they'll be in your arms before you know it.